Hi, I'm Dai Chung, Chief Medical Officer of Joint Pediatric Enterprise of Children's Health and UT Southwestern Medical Center. And welcome to the In the Know video series. Good afternoon. Today we have Dr. Adam Alder, who's an Associate Professor of Surgery at UT Southwestern and Children's Health, and a Chief of Surgery at Plano. I'm here with him today to learn more about his program and all the other exciting things that are happening in Northern Market. Dr. Alder?
Thanks for having me.
Absolutely. Can you tell us, share with the audience about lots of exciting surgical programs that you are leading or working closely and collaborating with other surgical teams?
The place to start is probably with the Pectus program. It's called the Center for Pectus and Chest Wall Anomalies. In the past few years, we've seen 100% growth in terms of the numbers of patients that we're operating on, and as well the number of patients that we're seeing in the clinic. They're active and youthful, and they've got this change in their chest wall shape that kind of appears out of nowhere. And for some, it's distressing. For others, they're just looking for reassurance that they're safe to continue to play their sports or be active.
So when you talk about Pectus program, you think the most physicians in the community, or for that matter in our system, are quite familiar with what is the condition, and is there really a medical treatment for it, or for that matter, surgical treatment for it?
We continually hear about patients being told that this is just a cosmetic procedure. And what I found, and this is both found in the data, in the research that's being done, as well as anecdotal reports from families and patients, that it's almost never just for cosmetic purposes. I just had a patient who finished therapy. We ended up taking out the hardware that's routinely done around 3 years or so. And he had told his family right after the operation, wow, I never knew what it was like to take a big, deep breath until I had this done. So it's pretty amazing how much of an effect this has.
Are all of these patients require surgery, or are there medical treatment for multiple different types of this chest wall deformity?
The first thing that I tell families, whether they have a pectus excavatum, which is when the chest wall sinks in, or if they've got a pectus carinatum, which is when the chest wall protrudes, their kids are safe. There's not the same obligation to undergo this procedure as if, for example, you were in a car wreck and needed to have something repaired. So that's the first thing that families come seeking, is that reassurance that their kids are safe. Then the second thing is that for most of those excavatum patients, surgery is the primary mode of therapy. There are some non-surgical things like the vacuum bell, but we haven't had as many families choose that direction to go. The pectus carinatum patients, however, they're almost always treated using a bracing system. So surgery is really second-line treatment for them. And those treatments, those bracing treatments are really valuable. In fact, we're one of the few centers in the country that offer the dynamic compression bracing system. And that's a system that lets us be very precise as we measure exactly how much pressure is applied to the chest. And when it's worn, using that system, we've achieved over 80–90% effectiveness in adjusting the shape of the chest wall.
So clearly this is a comprehensive center taking care of multiple different types of chest wall deformity.
Yeah, in addition to those sternal malposition conditions we just talked about, those pectus deformities, we take care of rib anomalies, clicking ribs, pain. There's all sorts of things that go on the chest wall. And it's actually given us some expertise as we support our oncology colleagues in those patients that need chest wall reconstruction and things after resection.
Great. So I wonder if you can elaborate a little bit more about the center and what it means to this community or the region on a national scale.
What's great about this program is that we've got dedicated resources at all levels. Being able to deliver a comprehensive program like that to this community that serves really the entire DFW, Northern Texas, Southern United States, is really a fantastic thing. And one of the things that's changed most recently is that the company that produces the bar and hardware that we use to do this reconstruction, we're one of their first centers to bring out a new bar system that's all titanium. It's really been revolutionary for how the family's been concerned about allergies to these metal devices that we put in.
Now, even the surgery itself has evolved over the past 2+ decades, right? Because it used to be where this is a major open surgery with physically removing parts of the ribs to now this minimally invasive. I wonder if you can kind of elaborate on that.
The majority of these cases are done using the Pectus bar and Dr. Nuss's technique. Now, what he showed us to do is much like someone would have braces on their teeth. Instead of having to remove all the teeth and then do something new, what this allows us to do is just shift things around. Now, the biggest difference is that instead of having multiple small incremental changes, we do all of this adjusting under anesthesia at one time. And so one of the biggest advancements, and this is something that we started doing about 5 years ago, was using a technique where we treat the nerves of the chest wall using a cryo or an ice cold probe. And that gives the patients really 2 months of pain relief. And when we published our results, they reduced their hospital stays from 4 to 5 days down to 1 day. So it's really a dramatic change. Really, I would not perform this procedure now if I couldn't do that. So families can expect a little bit of time where the patients need to recover. And that's something that they get through actually pretty quickly. But some people are worried that they're never going to be able to go back to those activities that they really enjoy, whether that's a sports activity or even something as simple as, hey, a hiking or going out and doing something like that. And what I enjoy letting them know is that, hey, once things have healed into place, we get you back to everything. There's no restrictions once the hardware is healed. And so we have kids who are playing ice hockey, soccer, football, lacrosse, tennis. We've got kids pole vaulting and rock climbing, which is really a remarkable thing. And they report back to me things like, hey, I took a minute off my mile time, or I've been able to really compete better or perform better. It's really, really great to hear how much things are better and how much change that these kids have.
That's great to hear. All these advances with minimally invasive and certainly even better pain management. Yeah. It's all good for adolescents and teenagers in this area. With your new role since the early part of this year as Chief of Surgery at Plano Children's Health, tell us about what is that role involved, and as well as some of the many other surgical programs that you are now intimately positioned to help guide and supervise and lead.
Northern Texas is really this exploding population. So I spend a lot of my time thinking about what we can do as a system and as a division to really serve this growing population. And what can be done really as we expand services with the expansion of the building, with the expansion of physician services, et cetera, to serve this population, this growing population, so that they don't have to leave.
So what are some of the previews of those potential programs or expansion of surgical services?
Oh, as I've gotten to know leaders in all of the other surgical areas, I'm discovering even things that I wasn't aware enough about. So things that the Andrews Institute is doing with local high schools, different sports programs that they've got involved in. In fact, expanding some of their services in non-surgical sports medicine at our Plano location. I've gotten to talk with the ENT service about the ways that they're doing endoscopic ear surgery and cochlear implants, in addition to all of their other kind of usual pediatric ENT care. And then within the division that I'm in, looking at growth both in support of some really critical programs for the hospital, specifically the GI program and the oncology program, but as well thinking about what we're doing by expanding our trauma-related services, and then looking at as we continue to see growth in the Pectus program. And then lastly, bringing expertise from the university, where we've got minimal access techniques that are affecting everything from the way we treat appendicitis, all the way to the way we're doing pectus excavatum surgery and neonatal surgery, all these other things where we're using super tiny incisions to do these really big operations.
So this all sounds great and exciting, especially with the tower expansion, fourth quarter of 2024. Are we then kind of primed and positioned that any and all surgical care services will be provided here at Plano?
I love that you brought up the expansion tower. The fact that we're going to have one of the larger freestanding children's hospitals specific to this region is really a huge sign of the investment and the interest that the system has in this growing community. What I'm excited about is that as physicians join, as we expand these services, that there's probably only going to be a very short list, a very small number of cases where people would need to leave the area in order to get that sort of super high level care. I'm actually excited about the fact that we've got people coming even from out of state and other regions to come and get care at this facility.
So clearly, you're a very highly advanced technical surgeon, but it takes an army of other experts and colleagues and collaborators and team members to really provide this kind of care, right?
We have a committee that includes both representation from our group, physical therapy and occupational therapy, to include the both inpatient children's team as well as the Andrews team for those kids who are interested in doing that. We've got anesthesia representation. We've got a tremendous amount of comprehensive, kind of 360-degree team care that's required really to perform well for this procedure.
That sounds great. And sort of one last question. What do you love the most about being at Children's Health or doing what you do here?
The biggest thing that I've found at this system is that I've never seen anybody commit to patient care in the way that these folks have. The fact that I get to come here every day with the support of the administration, it's really a fantastic way for me to focus on patient care and not worry about a lot of the other things. The partnership between UT Southwestern and Children's, I think, is one of the keys to success.